Hello, this FERNE educational video addresses the issue of ED patients with dizziness and vertigo with an attempt to successfully diagnose and treat serious central etiologies. This video talks about the neurological exam that occurs in patients with vertigo. My name is Ed Sloan. I'm with FERNE.org. More information to follow. So we're talking about the neurological exam that supplements the HINTS Plus exam in emergency department patients with vertigo, attempting to figure out if it is a peripheral or central etiology. So the HINTS exam addresses head impulse, nystagmus, test of skew, truncal ataxia and ataxic gait, and evidence of anterior stroke signs, which I've added because all of these are bad. If any of these are found to be positive, it's a red light. There's a likely central etiology. So let's talk about this. If you believe that acute vestibular syndrome is caused by a peripheral etiology, then you should have no findings on a neurological exam. There should be no cranial nerve, brainstem, or cerebellar findings. What would be a finding consistent with the central etiology? Limb ataxia, dysarthria, hearing loss, pain and temperature sensory loss, which I put a few stars next to because this is more than your typical just checking for light touch. Diplopia, ptosis, anisocoria, and dim vision also would suggest a central etiology. So, in conclusion, besides doing the HINTS Plus exam, add one more plus. Do a neurological exam looking for central findings in the cranial nerves, ptosis, unequal pupils or hearing loss, in the brainstem or posterior circulation, pain and temperature sensory loss, dim vision, dysarthria, and cerebellar findings such as limb ataxia. If you believe the vertigo is caused by a peripheral etiology, there should be no cranial nerve, brainstem, or cerebellar findings. Again, I'm Ed Sloan. Thank you for your time. I work with FERNE, the Foundation for Education and Research in Neurological Emergencies, FERNE.org. I serve as FERNE President and Board Chair. I have no financial conflicts. Please go to our FERNE.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo. And follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies. And if you have any comments or questions, please get a hold of us at fern.org at gmail.com. Thank you again, and have a good day.